Hello, how are you? Now we will be trying to tackle the one of the major complications of acute infectious diarrhea, which is in particular dehydration. It's very important. So we have here three classifications for pediatrics. Then after pediatrics would be adults for comparison. Okay, this is in clinical setting, especially in the hospital. For pediatric nursing, pediatric wards, uh, we will try to classify our patients based on the dehydration status that they have. First, we have no dehydrations or no signs of dehydration. Then we have mild to moderate dehydration. Then we have severe dehydration. So depending on the child, no, we have infant or we have child. For infant, that is usually less than 12 months. Then after 12 months, that's already a child. Um, for no signs of dehydration, the fluid deficit in terms of percentage, that is less than 5% for infants, 3% for child. Then for mild to moderate dehydration, that would be 5 to 10%, 6% for children. Then for severe dehydration, less than 10, more than 10%, or that would be equivalent to 9%. For children, that would be easy to memorize because that is just by proportion of um, about 1 is to 3. So 3%, we have 6% and 9% for our children. For infant, divisible by 5, less than 5, 5 to 10 for mild to moderate, then more than 10% for severe dehydration. The thing which is different here for our IMCI protocol is that for our IMCI, we use the term some dehydration for this middle classification, which is mild to moderate dehydration. Same for the green category for IMCI, which is no signs of dehydration here. And for severe dehydration here, it's pink classification in IMCI. So in IMCI, we only used four parameters. Here we have the general condition, the presence of thirst, fontanelle condition in the eyes also. We need to see the eyes, presence of tears. We have cutaneous perfusion or capillary refill time. It's included here. Then respiration. This might be termed as respiratory pattern. But actually, if you will be looking at this is respiratory rate. No, for this one, this can be called as respiratory pattern. Then we have skin pinch. This is used also in IMCI. Then history of urine output. For the urine output, this is not used in IMCI. Then for the general interpretation, we have this. So for no signs of dehydration, we have well alert patient drinks normally and are thirsty with normal fontanelles or eyes. Then tears are present. Remember that. So meaning they are not dehydrated yet, but they have the manifestation, which is diarrhea commonly. So cutaneous perfusion, which is less than 2 seconds. Then remember, 2 seconds, the boundary is already mild to moderate dehydration. Then for the respiration, that's normal. Then skin pinch goes back quickly, which is normal. Normal urine output. For our mild to moderate dehydration, restless, irritable, which is the same with IMCI, and thirsty, drinks eagerly, the same with IMCI. Then slightly depressed fontanelle, which is equivalent to slightly sunken eyes. Remember, our fontanelles would only be applicable for anterior fontanelle, that would be up to 18 months only at maximum. Some child or some children would be 12 months. So in range 12 to 18 months, usually the anterior fontanelle would be closed. Then 2 to 3 months for our posterior fontanelle or the triangle fontanelle at the back. For our cutaneous perfusion, again, our capillary refill time, that is around 2 seconds. Then for respiration, that is deep, maybe rapid. And for our skin pinch, it goes back slowly. Then for the urine output, this is not present in IMCI again. That is usually less than 0.5 ml per kilogram per hour in 8 hours. For severe dehydration, this time we need to be conscious with this because this classification requires us to use commonly IVF therapy for our patient. So lethargic and consciousness for the general condition. Then they drink poorly, not able, or they couldn't drink even. So they have sunken eyes. They don't have tears. They have more than 3 seconds capillary refill time. There's deep and rapid respiration. And 2 months to 12 months, more than or equal to 50 breaths per minute. The same with IMCI. And for 12 more than 12 months or to 5 years, that is more than equal to 40 breaths per minute. And the skin pinch goes back very slowly. And remember, our urine output here is minimal, which is equivalent to less than 0.3 ml per kilogram per hour in 16 hours, or there is no urine output in 12 hours. So if the patient has two or more of the mild to moderate dehydration signs and symptoms, there is mild to moderate dehydration. So if the patient has two or more, again, the minimal requirement is two, which is the same with IMCI, or more of the above signs, there is severe dehydration. So this is for our pediatrics. How about for adult? For our adults is our classification is mild dehydration. It starts with mild dehydration, then moderate dehydration, then severe dehydration. So here we have fatigue, thirst, sunken eyes, blood pressure, respiratory rate, pulse rate, peripheral circulation, level of consciousness, and oral mucosa, then muscle weakness, skin turgor, capillary refill time, and the urine output. These are our parameters for our dehydration. For mild dehydration, there might be fatigue, thirst, but it's only optional. Um, the blood pressure is normal, the RR is normal, pulse rate is normal, uh, peripheral circulation is warm, which is normal, level of consciousness is alert, which is normal, and moist oral mucosa, then normal skin turgor, there is no muscle weakness, capillary refill time is normal, and the urine output is also normal, which is equivalent to or more than 0.5 ml per kilogram per hour. For moderate dehydration, all you need to remember here is that it's just that it is almost the same with severe dehydration, but in our severe dehydration, there are signs of shock. For example, there is uh, blood pressure of less than 90/60, which is a shock blood pressure, which is there is also tachypnea, in which the RR of the patient is more than or equal to 25. Remember, tachypnea is defined as an RR of more than 25. So that is now the update in regards to tachypnea, no more than 25. Then we have faint or steady pulse rate. Then there is coma or stupor, and muscle weakness is severe. And remember, the urine output is less than 0.5. If there are signs of shock, that is severe dehydration. If none, then that is only moderate dehydration. For skin turgor, again, this is best assessed at this is important, this is an update. The anterior forearm, the anterior thigh, anterior chest, subclavicular area or sternum. Not the same with children or infants, which is being assessed at the abdomen. So this is not applicable for adults. It's only anterior forearm, anterior thigh, anterior chest, subclavicular area or sternum. Then for the capillary refill time, should be assessed with the examiner's middle finger at the same level of the patient's head. For now, that would be all for our clinical parameters for the adults, and previously that was parameters of children. Again, this is adults. Thank you very much.